So this year is a big year for pediatric MS because we finally had some clinical trials that have been performed in children in having pediatric MS, and we have some quite interesting results on these oral treatment that are not actually available for children. So this is really a breakthrough for us, and tomorrow is going to be we are going to have results about that clinical trial. Today, the main problem for pediatric MS is to reply to parents who are asking how it's going to evolve, because the disease started earlier, and there are studies saying that the disease may be longer to attain, for example, the secondary phase of the disease in children, but still these studies have been made earlier before the treatment that children can have today. So this is the main field, and then the second part is to know what we should go and see in these children. What should we follow in these children? Would it be EDSS score, which is always very low in our pediatric patients, and would it be the cognitive aspect? So these are the main questions that we need to reply to parents. Pediatric MS is one of the very interesting field to look, specifically how the disease starts, for example, because as children are quite naive about the environment and exposure and other viral infection, etc. The disease, we can have some clues about the immunological aspect that triggers the disease, for example. So this is going to be very important to understand multiple causes, and the children could be a very important actor for that. I think two presentations were very important, interesting for me. First of all, it's going to be tomorrow because we participated in that study, and the other thing was about the cognitive evolution in children here in a poster. It's a German study that has been presented recently on the severe aspect of MS and how they wanted to treat that. Pediatric neurology actually, and of course pediatric MS field is a very important and very interesting aspect to look, because in pediatric neurology a lot of things have to be done, and pediatric MS is really something very important to look, because as I said previously, it's a very large and open field to go and look, because there are a lot of things to understand, for example, in the immunological part, because it's going to help us to understand the disease disease onset in MS.